Gavin Macgregor-Skinner is director of the Global Biorisk Advisory Council and an infectious disease expert. He joins me via Skype here in Washington. Gavin, welcome to our program. What was your biggest takeaway, headline, if you will, from President Xi's comments before the WHO?
I think it's important that we look at what platform actually exists and whether it's the WHO or some other platform to share the best practices, the lessons learned, but also more importantly, what hasn't worked, but also create a research agenda that is global. And as we keep talking about the WHO taking the lead and whether one country or another country has actually shared information, it hasn't been consistent, it hasn't been standardized. And again, we need to do much better as we're seeing that COVID-19 affects emotional, economic, as well as the disease implications throughout many countries. And a lot of people are suffering because of the SARS-CoV-2 virus that causes COVID-19. So we need to look at this through a different lens now than it's not business as usual.
Indeed, and President Xi also pledged $2 billion to help countries fight this pandemic. Gavin, would you happen to know how these funds would be distributed? Would it go directly to the WHO? And the timing is certainly interesting. Comes at during the time that the United States has cut greatly or reduced its funding to the WHO.
Well, it's very interesting to look at the World Health Organization and how it's set itself up. They have their headquarters based in Geneva. They have regional headquarters throughout the world, and then they have offices in many countries. And it's important where that money goes and how it's going to be spent. But what we're lacking right now is these sort of rapid, ready response teams, these international teams, like we did for Ebola in 2014. I had 3 trips with WHO to West Africa as part of a team to help build capacity and fill necessary gaps. And I think if wherever that money goes right now, I don't even know exactly where it'll be going, but where it goes, it needs to start focusing on what countries need. So countries at the World Health Assembly should be asking, we need this. And then when we find out what they need, we then be able to form international teams that can respond a lot faster than what we're doing, because we're not sending teams at the moment, but to also help them build up capacity.
Where do we stand with vaccines, Gavin? President Xi says if China is the first country to develop a vaccine, of course, they're going to share it for the global public good. And I know China has 5 potential vaccines in clinical trials.
This is a really important point because what we haven't been doing a very good job on knowing about the numbers. Now, we know that everyone is working very hard in many countries, many laboratories around the world, looking at research into a vaccine against COVID-19 virus. But in history, we haven't developed a coronavirus vaccine ever. And if we do, this will be the first time. When we do develop a vaccine, it takes time to produce and manufacture the number of doses. So we should know what those numbers are so we can realistically tell the population of the world how long it's going to take to research the vaccine once it's identified, how long it's going to take to develop, and then 2, how we're going to distribute it. And it's going to take not months, but years to do this after the vaccine has been developed. And we're not getting those realistic, real-world messages being told to everyone because everyone thinks the vaccine's coming very soon, and it's not.
And when is the soonest you think we're going to have a vaccine?
Well, it takes time. And from research, we know that it's a 12 to 18-month process. There's phases that we have to go through. First of all, to ensure the vaccine is safe. Then we have to ensure that it works, it's effective. And then we have to once we identify that vaccine, then it has to be manufactured and distributed. And it's a lot of those supply chains and needs for distribution that we're lacking right now. And I think what I'm not seeing from the World Health Assembly that's being held in Geneva right now is who's attending and are the right people attending, and where's the role of academia, universities, as well as big business, and as well as many other people that should actually be at that meeting and not just health experts.
All right, we'll have to leave it there. Gavin, thank you so much.